Increasingly, we're recognizing that abscesses in other organs, like the liver, can be a very serious complications in CGD. And this is being recognized as patients are living longer with CGD. We're doing a better job of antibiotic prophylaxis. But even despite antibiotic prophylaxis, liver abscess can emerge and tends to emerge in patients with CGD, and we do not have. We're still learning what the best treatment approach is for those patients. So there is a significant morbidity associated with abscesses of the liver in patients with CGD.
Whenever we're taking care of patients with primary immunodeficiencies, a team effort is needed. Oftentimes these children live far away from the actual immunologists, and so we immunologists rely on the local pediatricians to help us with the day-to-day management of the patients. That can include being able to see children quickly when they present with fevers or other illnesses. That can also include making sure that nurses are available to teach the patients how to use their medicines properly.
There are a few aspects of caring for a patient with CGD that are important to keep in mind. Some unique features. This is a relatively rare disease, and one of the things that's unique about it is this relatively small list of pathogens that frequently cause disease in CGD. Even though the neutrophil is a major component of host defense, and even though the neutrophil is involved in the clearance of many types of organisms, it's really only about 5 pathogens that cause the bulk of infectious disease in these patients. And for that reason, we've been able to become pretty effective with prevention of these infections.
Lifestyle modifications matter, so patients with CGD are most susceptible to certain bacteria and certain fungus that can be found in the environment. So we always caution our CGD patients that they limit exposure to areas where certain types of fungus or mold might come into contact in the air. And so places like that are found in sort of warm, humid environments like barns or caves, or when houses are undergoing renovation. So our CGD patients should never be in those kinds of environment. The other place that we run into a lot, being from Florida, is fresh water and brackish water specifically. So brackish water is when salt water and fresh water meet. The salinity can change of the water itself, but certain bacteria grow in that environment and can be very life-threatening in CGD patients should they become infected with those bacteria. And so we caution our patients that they should not swim in those environments. So those are some of the considerations that families have to take and healthcare providers need to caution their patients about.
So the standard of therapy for patients with CGD is to start on prophylactic therapies. These have to be an antifungal, such as itraconazole, that's the one that's been most studied, and some kind of antibiotic that will help prevent the development of Burkholderia serratia in staph. And so most commonly in patients who are able to tolerate, Bactrim is the drug of choice. These are for standard management. The other thing that we recommend is that they have frequent exams followed up at a center, and frequent imaging, even though people worry about the exposure of radiation, given that a lot of patients end up with asymptomatic fungal infections or pneumonias of considerable size, we think that prophylactic imaging is of benefit.
The third element in the triad of things for prophylaxis for CGD patients is gamma interferon. There was a double-blinded study conducted in 1989 which showed that 3 times a week use of gamma interferon can reduce the frequency of infection. To be fair, we still don't know exactly how it does that. We think that it's, in a very general way, increases the surveillance of the immune system. But there's a price to pay. Some patients may get fevers with this, although in most cases those fevers may subside over long-term use. Some patients may get nightmares, have trouble concentrating, and so on. And although there's a standard amount that's recommended, at least at the NIH, we would rather see someone take the gamma interferon than not, and so we'll work with them. We'll lower the dose, we'll lower the frequency. Important to know that we don't have data about what happens when you lower the dose or lower the frequency in terms of protective effect, but we think that this still provides protective effect.
Caring for patients with CGD can be difficult. They get sick often, and those infections can be severe. So having a team that helps care for these patients is essential. That includes primary care to check on general health and be the first call if that patient is concerned they have an infection. But primary care physicians are going to need support because these patients are rare and it can be difficult to anticipate what they will do next. And so having immunology and infectious disease and bone marrow transplant to offer a full range of care for these patients is essential. In addition, having support services, including home health and social work, can help address any barriers to care and help patients maintain compliance with their prophylactic antibiotics. I think one of the things that physicians need to understand about CGD is because it's so rare, a lot of patients can feel very isolated in their diagnosis. Helping patients feel that they are connected to a community can be essential to helping them accept their diagnosis and also making sure that they have access to supportive services, to behavioral health is really essential, especially as they become older and become teenagers and transition to young adulthood.